After adjusting both the x and y axes, we decided to explore the relation between education and child mortality, which is defined as the number of 0 to 5-year-olds who die per 1,000 born. Firstly, we investigated the total adult literacy rate characterized by the variables percentage of people above 15 years old who can write simple statements and the variable child mortality. We observed a general pattern. As literacy rate increases, child mortality decreases. Beginning in 1981, we noticed that countries, including Nepal and Bangladesh, had comparatively low literacy rates, 20.6% and 29.2% respectively. As the years progressed, not only did literacy rate approximately increase by 30%, but child mortality rate decreased by roughly 150 children. Although the graph exhibits a negative correlation, we perceived it was a non-causal relationship and decided to explore the possible story behind our finding. While it might be surmised that literacy in general is linked to a more affluent population, better sanitation, and other factors associated with development, female literacy in particular has been shown to be a significant factor in improving the health of infants and reducing the risks associated with childbirth. It is hypothesized that women with improved access to birth control and knowledge can exercise educated management over their fertility.
According to UNESCO, women who attended literacy and basic education programs gained health-related benefits in comparison to those who chose not to participate. Women who engaged in educational groups were more likely to seek medical help for themselves and their children. Joan Swassberg, Director of Aging and Community Health at the American Medical Association, reveals that our literate patients often avoid clinics and hospitals as the paperwork involved is frightening.
With such assertions in mind, we decided to narrow our search to the literacy rate of females who are above 15 years old versus child mortality. Overall, it is apparent that literacy of women is relatively more important for both population stabilization and lower infant mortality than male literacy rates. Our findings suggest that gender equality in literacy must be considered important. So, we revisited Nepal and Bangladesh's statistics. As female literacy rates skyrocketed over the 30-year span, the corresponding child mortality rate fell.
In 2000, UNICEF Nepal carried out a health survey of 2,000 residents of two districts near the Kathmandu Valley. The results indicated a correspondence between literacy abilities and health knowledge. Findings concurred the influence of a mother's health understanding on her child's well-being. Yet the study acknowledged the impact of radio broadcast, television, and other media forms on maternal knowledge. Therefore, additional data regarding media consumption may generate a clearer picture.
Additionally, we investigated India's positioning on the graph. During 1981, the female literacy rate was 25.7%, and in 2006, the level increased to 50.8%. Accordingly, child mortality declined from 163 to 71.5.
University of Cambridge affirms that for a common Indian district in the early 2000s, the poverty gap would have had to be lowered by 25% to save one child per thousand lives born, but a mere 4% growth in literacy rate would yield the same impact. Although the graph shows the value of improved literacy in India in relation to child mortality, it fails to point out the consequences of said rate in each district region. Accordingly, more district-specific data might advance our efforts to convey the full story behind our discoveries. Other factors, including population and governing, appear to contribute to the child mortality rate in Uttar Pradesh, a northern state in India.
We also looked at Afghanistan's movement on the graph. In 1979, female literacy is a mere rate of 4.99. In 2011, the figure increased to 13% and child mortality correspondingly decreased. Female literacy in Afghanistan is critically low, although literacy across the entire population is a serious problem.
Despite the flood of humanitarian assistance funneled into Afghanistan by outside organizations, female literacy has been given low priority. It could not only improve overall health but also reduce the national poverty rate and counteract fundamentalistic influences, which have attempted to stifle girls' ability to attend school. The data in Afghanistan is consistent with that of other nations regarding maternal literacy. The more educated a mother is, the more likely she is to survive childbirth, to marry later and give birth later, to have children who are attending school, who are vaccinated, who are well nourished, and who survive infancy and then childhood. To conclude, nations committed to improving the health and education of its population cannot ignore other determinants to improve maternal health. In fact, female literacy by itself cannot be the sole determinant impacting infant mortality. Female literacy, by its empowering role, acts as an additive ingredient to various other factors. There is also another argument in favor of increasing female literacy from a social justice perspective: education. Education is a basic human right, and it should not be viewed solely in terms of the benefits it bestows on others.